All right, good afternoon, everyone. My name is Abby Jankos from the New England QIN-QIO, which is the Quality Innovation Network Quality Improvement Organization, and I will be moderating today's webinar. Thank you all for joining us for this first monthly webinar in the series for the New England Home Health Collaborative, Improving Cardiovascular Health. Before we get started, I'm going to quickly review a few housekeeping items. This call will be recorded and the presentation will be available within a few business days after the webinar on our website. I'll provide you with details on accessing the recording at the end of this webinar. The phone lines will be on mute for the duration of the presentation, and we'll take questions at the end, and I'll provide you instructions on how to unmute your line at that time. So now I will introduce today's speaker, Kathy Roby. Kathy is the Connecticut Home Health Lead for the New England Quality Innovation Network Quality Improvement Organization. Kathy is a registered nurse with over 40 years of experience in home health care. She specializes in quality management, improving home health providers' clinical outcomes, and reducing acute care hospitalizations for Connecticut home care providers. So please welcome Kathy Roby.
Good afternoon, everyone, and a happy cold day in February. I don't know how it is where you are, but here we're referring to it as a warm day in February because it finally broke almost 30. Today is the first of our monthly series of Home Health Collaborative Learning and Action Network meetings. Each month, in the second week of the month, usually a Wednesday, we are going to have our monthly Learning and Action Network webinar. These meetings will bring together all of us in home health who have decided to work together to improve the cardiovascular health of those people that we see at home and in the community. And I'm really delighted to have all of you with us today. What we would like to do is we're going to talk a little bit about what the New England Quality Innovation Network is. To begin with, as Abby said, I'm from Qualidigm. And Qualidigm is one of two organizations who came together last year to form the New England Quality Innovation Network, or QIN, which is a QIO, a Quality Improvement Organization. Health-Centric Advisors is the lead in our New England QIN, and they are working closely with those home health providers who are in Massachusetts, Maine, and Rhode Island. Here at Qualidigm, we are working with those providers in Connecticut, New Hampshire, and Vermont. But each month, as we gather together for these calls, we will be speaking together as agencies across all 6 New England states, united together, once again, part of the CMS QIO project. They neglected us for the last 6 years as they did the 9th and 10th scopes of work. But now that they've opened the 11th scope, we are once again part of the project, and we're delighted to be back on their radar screen. For once, it's a good thing. To begin this project, I'd like to welcome those who have already chosen to sign their participation agreements. The participation agreement, for those who may not have already seen one, is a document that simply says our agency has chosen to work with the QIN-QIO to aggressively try to improve our cardiovascular outcomes for our patients. And as part of that process, we are going to be improving our transitions of care and decreasing hospitalizations. So these 16 agencies are our current Connecticut partners in the New England QIN-QIO. And my name's up there because I'm going to be their primary contact. In Massachusetts, the South Coast Visiting Nurse Association has joined us. And your contact folks for the state of Massachusetts agencies will be Pat McLeod and Barbara Davis. Their emails are up there. In New Hampshire, we're delighted to have Interim Healthcare, Lakes Region VNA, Nurses PRN doing business as Silver Touch Home Health Care. Your contact is Georgette Verhel and Leslie Moeller. We also have contact folks for you in Rhode Island, Vermont, and Maine. Brenda Jenkins is happy to speak to those in Rhode Island about their participation agreements. Mary and Gail are up in Vermont, anxiously waiting to welcome some new members, as is Doreen in the state of Maine. So what are we actually going to be talking about today and every month as we gather? To begin with, the focus of what we are doing is centered around the existing Home Health Quality Improvement Project. If you recall, back a long time ago in the 8th scope of work, which is when we last worked together on a QIO project, HHQI as a website came into being. The actual website is there on your screen, www.homehealthquality.org. So part of being active in this project and being a participating agency means that we would like you to go to the HHQI website and register. How would you do that? By going to the website, and on the home page, you're going to select the registration tab. Complete all of the fields, and one of the things it will ask you is who is your agency contact. So you will need to think about whom you would like to have as your agency championship for this project. Someone needs to take the lead. Someone who can work actively with your nurses, who can enlist their cooperation and give them a little enthusiasm. That person is also going to need a backup because, believe it or not, summer will come and they will want to take a day or two off. Once you've registered, if you've not been to the HHQI website before, please feel free to click on every tab and explore all of its many resources. It's going to be a tremendous asset to you as you go forward. This is what the HHQI website actually looks like. As I said, you're going to need to register. The blue ribbon across the top is all of the different tabs. We're going to talk about one of the other ones as well, but the second from the right says registration. You will need to begin there, selecting a password as you register your agency, identifying your in-house champion and their backup, and completing all of the required fields. Once you've done that, you will be able to simply click on the login in the upper right-hand corner in the future. Now, if we look quickly at some of the other tabs, this is a screenshot, not live. You would be able to identify some of the other resources. The webinar tab, for instance, the farthest over on the right, is where you will find their recordings of a tremendous number of programs they've presented in the past. If you go to the website live and you click on webinars, I do want to call your attention there to a program called Managing by Data. This is a wonderful webinar where Rita Grimes goes through the process of using your CASPA report, where all of your OASIS data is collected and analyzed. If you've lost your password or if you've forgotten how to run these, please go to this webinar and you will relearn how to use this extremely valuable information. But in the middle, you'll see the tab that says Cardiovascular Health, and that's where you're going to go next. This is where you will click in order to join the HHQI Cardiovascular LAN. As I said, the goal of our collaborative group is to improve cardiovascular outcomes. In order to do that, we all need to participate together in this project. So let's get you registered. When you go to the HHQI website live, and you click on that tab in the center that says Cardiovascular Health, you're going to get a drop-down. That drop-down is going to say Cardio LAN, somewhere around the middle. Click on that. It's going to take you to the Cardio LAN home screen. There's a blue button on the left, and that is where you'll go to complete your registration. Once you've done that, you can then begin to cruise through the whole Cardio LAN website section. look at the quality measures, read some of the information, and look at some of the previous webinars that have already been held. This is what that section looks like. This is the cardiovascular health LAN section of the HHQI website. There's that blue button. It says Join Now, the Learning in Action Network. On the left, you can see Cardio Milestones, Cardio LAN in a lighter blue. Under that, the webinars. Below that, the best practices. You remember the best practice packages from in the AID scope? And I remember hearing from many Connecticut agencies about the best practice BPIPs and how everyone said, aren't they absolutely wonderful? Except they're 85 pages long, and who, in God's name, has time to read them, let alone implement them? And I'm too busy, too short-staffed. I don't have the time to do all these wonderful things. But you know what? I heard you. And when we were brought into the 11th scope as home care providers, and the BPIPs are being reproduced and new ones are coming out, I remember what you said. And so each month, as we gather for this webinar LAN, what we're going to do is we're going to take a small section of one of these BPIPs, and I'm going to take those best practices and give you a very short synopsis of a section that you can implement easily, quickly, and without a lot of fuss, so that instead of you reading 80 pages, I'll do it. And I'll present you a section each time we gather every month. So go to this page, click on the big blue button, and get yourself registered. And one of the first things you'll see there once you've done that is you have 6 measures that you can select from. We're calling those, HHQI is, the ABCs. These are the 6 quality measures that you have to choose from. The ABCs are anticoagulation, blood pressure control, cholesterol control, and smoking cessation. These 6 measures all relate to those specific items. And so as you can see here, the first one and the 5th one have to do with cholesterol control. The second one has to do with the use of aspirin or other anticoagulants. The next 2 have to do with controlling blood pressures, and the final one is screening and cessation interventions for tobacco use or non-use. The goal is that once you've registered and become part of the Cardio LAN, you will select any one or more of those measures. But you really only need to pick one, and that's what you're going to work on with your patients. How will you go about doing that, you ask? This is truly, among all the data collection and work projects that CMS has ever done with home health, I promise you this is the easiest one you're ever going to see. They have done a preliminary analysis of the amount of time that it will take for you to participate in this project with us. CMS tells us that for a mid-sized agency, which they are defining as one with an average daily census of 200 patients or more, that it will take you approximately 2 to 3 hours per month to gather and input the data. That's really not very much. If you are much larger, yes, it might take you as much as 4 hours to gather and input the data. But we're going to look at the data abstraction process, the chart abstraction tool, and the data entry process so that you will see that it truly is a simple, easy process that will not add to your already enormous workload. I've been a provider. I've been a clinical manager. I would not ask you to do this if I didn't think that it was something feasible and valuable for you to do. So let's look at the first item. Once you've selected one of those measures, here's how we're going to go about this. The process flowchart in the upper left corner is step 1. Step 1 is to review the resources that have been made available to you. the cardiovascular best practice packages, and then join the CardioLand, which we've already talked about, going to the web link provided on the earlier slide, clicking on the blue button, and registering yourself. You will need to create a data access account so that you can enter the information you've gathered. There is a tutorial, and when you are on the website and you click on that blue link that says Data Access Tutorial in the flowchart, it will take you right to a short 12 to 15-minute video vignette that will actually walk you through how to gather and input the data. Your next step is going to be determining what your agency's cardiac focus is going to be. That means, in step 3, select the measure that your agency would like to work on. As I said, there are 6, but you absolutely only need to do 1. Pick the one that you think is going to give you, as they say, the best bang for your buck, only in this case it's free. So you'll select one of those 6 items, one of those measures, and you can actually change that measure every month. I would recommend that you select a measure and stay with it for at least 4 to 6 months in order to see improvement. And then you could certainly change to a second one or add a second one if that was your choice. Consider where the information might be found in the way your agency has set up your patient records. And we are going to look at the chart abstraction tool in just a moment. Here in step 4, they discuss what your process might be for collecting and entering the data in the data registry. They have given you some options. My suggestion for you, which would make this process, I believe, truly extremely easy. When you select a measure, for instance, the anticoagulation use of aspirin therapy, when you select that measure and click on that particular measure on the website, you're going to get a page that has at the bottom a list of ICD-9 codes. If you print that page and attach it to the data collection tool, put it in your intake department. As the intake nurse accepts referrals, if the patient has one of those diagnoses at the bottom of that page for that measure, simply have her attach the data collection tool to the referral. Once the nurse has admitted the record, she can enter the patient's name and medical record number in there and leave it in the file. When the patient is discharged, the discharging nurse can simply answer the remaining, and I mean this, there are only 2 or 3 questions left to be answered. She can answer those and then turn that piece of paper over to a clerical level person who can do the data entry. It does not require the skills of a clinician to do the data entry, only to answer the 3 to 5 questions on the paper tool. That way, you have minimized to almost none the time and energy required on the part of your clinicians, but you're still going to have really effective data collection. On the 15th of the month, that designated individual who's going to do the data entry would go to the data registry, log in with their data access user ID, click on HHCDR on the brown toolbar. Following your process, they're going to then enter the data as is indicated in the 3 steps of step 6. You can do more than 12 records if you choose to, just to have stronger data for your own use. But you're only required to have up to 12. Once you've saved all that information and clicked on Close Out the Month by the 14th, you'll be able to access and look at your internal reports on the website. And you'll learn some very interesting things about how your agency is progressing in improving your patient's cardiovascular health, in this case through the use of anticoagulation therapy. There's a sample of the data abstraction tool. As you can see, The first general patient information is right there and would be collected at the time of admission or an intake with the patient's ID number from OASIS item 20 and the start of care date. And then you would answer, or the intake nurse can, or the admission nurse, does this person have both a Medicare and a Medicaid number? They would then leave the tool in the record at the time of discharge. If the measure you selected was aspirin therapy, they only need to answer the next question. If you're working on blood pressure control, they would go down to the section on blood pressure control, answer that question, and so forth. So as I said, the data collection, the most you could possibly have to answer is the first two under general information, and if you're doing smoking cessation, you'd have to answer the last three at the very end. So you would never have to answer more than 5 questions. Not bad for data collection. So as I said, on the HHQI website, you're going to be using the best practice intervention packages. There are currently 3 of them already posted. Cardiovascular 1, which is on the topics of aspirin therapy and blood pressure control. Cardiovascular 2 has cholesterol management and smoking cessation. And there are several others on other topics from previous scopes of work that you might find to be very helpful and useful to your staff. We remember how big they were, though. Minimum 60, 70 pages. I think there was even one that clocked in at over 100. How can you use these effectively without overwhelming your staff and yourself? Select 1 or 2 of the measures to work on. Identify the section of the best practice package that relates to that measure only. Use the staff and patient education materials, the podcasts, the visual materials, the patient handouts, only the ones that apply to your measure. This targeted approach is going to dramatically decrease the stress and time that is involved, and you and your staff both. Let's look at an example. We've been talking about the use of aspirin therapy in patients with ischemic vascular disease. In the best practice package, HHQI's Cardiovascular 1, there are 4 pages of clinical education, 1 20-minute podcast, and a sample of a bulletin board you could create. If you were to use that, schedule a staff meeting. By regulation, we're required to provide 1 hour of clinical education every month. This is going to be applicable to nursing and all of the therapies. In that hour, you can circulate the 4 pages of clinical education, briefly review them, run the 20-minute podcast on the screen, have a 5 to 10-minute Q&A and discussion, and then go over the 4 handouts for patient education that are available in both English and Spanish. And guess what? You've just accomplished a 1-hour professional staff in-service education for the month of February, and you haven't had to spend any money. You haven't had to spend any time thinking of one and creating one. Everything has been given to you. And then if that is the measure you've selected, you can use the data abstraction tool, and for your first staff meeting, you can show it to the staff and discuss how they might go about collecting that data at admission and discharge. Another piece of our project is the Million Hearts campaign. As home health providers, yes, our focus is always on our patients and our care that we provide to them in their homes. But we are being asked as community health providers to look a little bit farther out this time. Our patients live and work in their communities, as we do. The Million Hearts campaign is looking at the wider picture, promoting the health of the whole community at large. And so we ask you, as part of participating in this project, to only indicate that you are a supporter of the goal of the Million Hearts campaign. And I've given you the web link so that you can go to the website and see it. This is what it looks like. This is the February homepage for the Million Hearts campaign. The initiative that they are seeking to do is in the lower left corner. Their goal is to prevent 1 million heart attacks and strokes by 2017. They would like to bring us all together, the community, health systems, nonprofit, for-profit. It makes no difference. We all live and work together, and we should care about heart disease and stroke. We should care about reducing it. So we ask you to go to this website. In the upper left, all we would like you to do is share your commitment by registering your support. Click on that drop-down in the upper left. You can sign on as an individual personally, which I've done. You can sign on as an organization, which Qualidigm has done. Click the Get Started button, and it will walk you through. Even if all you do as an organization or an individual is indicate that you support the goal and that you will personally do your best to reduce your own blood pressure and your own risk, that's good enough for us. But if you choose to do a little more, there are some very interesting things that you can do with minimal effort on your part. Register your agency as a healthcare provider. Indicate that you're a supporter. If you choose to go a step further, here are some examples of what you can do to promote your support of Million Hearts and cardiac wellness. Granted, nobody wants to be a lunchtime walker in February when it's 5 below. But there's always walking around your building, inside. There's always picking up the phone and then putting it down and walking to that person's desk to talk to them instead of picking up that phone. But lunchtime walkers as an agency-wide project, not jogging, not trotting, I'm not a runner myself, but a leisurely, reasonable walk for 15 minutes. Replace all those little carb goodies in your vending machine with healthy snacks. They do make machines that work that way. You can order the free no smoking policy signs. Post them in your bathrooms, in your hallways, and your elevators. That makes you a supporter of Million Hearts. And when you schedule the next company event, order yourselves a really large salad to go with that slightly smaller pizza, and that will do. It's a start. It's a step in the right direction. The last thing I'd like to talk a little bit about is a project that we will not be starting with home health until the fall at the earliest. But if you should have a spare moment, I'd like to direct your attention to something called Interact for home health providers. Interact stands for Interventions to Reduce Acute Care Transfers. If you remember, when we began, I said that one of our project pieces is to reduce acute care hospitalizations, reduce emergent care, and improve your outcomes. Part of doing that is to have smoother, more efficient, effective transitions. If your agency is currently part of a community of caring, then you are already working on this. You may have seen an Interact tool coming to you as part of a transfer from a hospital or a nursing home. Nursing homes have been using Interact for over a year. More and more of them every day are signing up to be part of the Interact project. In the fall, we'll begin training for home health, looking at how you can incorporate this into your care process. It has proven very effective in medication reconciliation and safe transfers in the nursing home world. The website at the bottom will take you directly to the home health section of the Interact website, and it will show you the tools that they have available. This is what the Interact website looks like. You'll be able to see here all the different tools that they have, how you would monitor how it's working, the communication tools. We're not going to start using these for a while, but as I said, I thought you might like to look at it. Take a look at some of the tools and see if they can be of use to you now. Lastly, as we meet each month having these webinars, we're going to include a section of our time together that we're going to call peer-to-peer sharing. As Abby said to you when she introduced me, and she wasn't supposed to tell you how really long I've been in this business, but I started in home health back when home care agencies were actually paid by the hospitals. And I'll bet there's no one on the line who can remember that far back. But once upon a time, we were. Our money went to them. We contracted to them, and they paid us. So ACOs, not such a new idea after all. But when we first began in home health, we helped one another. We cared about other agencies, and we reached out to one another to help with in-service, to do projects together. I know there's a great deal of competition between agencies these days. But since we are 6 states working together to improve our patient outcomes, I believe that we can improve our patients' outcomes in their episodes of care if we go back to working together, sharing ideas, helping everyone's outcomes to improve. So every month when we gather on the phone to have a webinar, to look at one of the best practice packages, we're going to allocate about 5 to 10 minutes for what we're calling peer-to-peer sharing and mentoring. Absolutely, an agency in southern Connecticut is not in competition with somebody in northern New Hampshire or Maine. So if you have a common problem, and I can think of several that we all share, like face-to-face, so we might be able to share some ideas together. If you're having difficulty getting your nurses to do something, to do effective medication reconciliation, getting summaries done, getting information transmitted, whatever your stumbling block is, this is going to be your opportunity. Send your questions in ahead of time to me. Put them up during our chat section. You can say, my name is Jane. You can name your agency or not, as you choose. Here's my problem. Has anyone else out there experienced this? Can you share with me what you might have done that worked or something that didn't work so we don't all make the same mistakes over and over? If you choose to, my email and the emails of the contact people for each state are in this slide presentation. Use our emails and send your questions to us. If you would rather have us read the problem during the peer-to-peer time, we're happy to do that. You can send us a solution you'd like to have shared with someone's previous question. We'll share it for you. But if you're willing to reach out directly to one another, just let us know. And we will put you in touch with one another so that you can have true peer-to-peer sharing and mentoring. We can help each other. And if we go back to that, reaching out and helping each other across the state lines, I think you're going to find that our outcomes are going to be better and we will be much more successful. Every third Thursday, the Home Health Quality Improvement website sponsors an educational webinar on a topic that is related to this project. If you haven't already registered, the webinar for this month is a week from tomorrow. I know an email popped up in my email today from them. Hopefully you got one too. If you didn't, go online to their website and register for this month's webinar. You will also be able, as I showed you earlier, on their homepage, be able to access all of their archived webinars from the past. These will be an excellent resource for you for many of the questions that you may have or things you're struggling with have already been presented in the years past or in the months past. So you can cruise through there and you'll find wonderful educational programs you can offer your staff. So please, circle that date on your calendar, the third Thursday, and go online today to register for the program that will be next week, a week from tomorrow. So that's our program for today. I do want to assure everyone before we open up to questions that we guarantee you that this webinar program, including the peer-to-peer sharing and the Q&A at the end, will never go over 50 minutes. I promise you, all I'm asking is 1 hour of your time once a month for us to come together, to learn together, to share together, to answer some questions together, and working together, we will improve those outcomes. I'm glad that you are here with me today, and I'm going to open the line up, and Abby will moderate so that we can answer any questions that people may have.
All right, thank you, Kathy. So at this time, we'll take a few questions. If you'd like to ask a question, please press *6 on your phone to unmute your line.
While we wait to see if anyone has any questions, we'll give it a minute or two. I do want to let everyone know that we will be posting this webinar. It has been recorded by CMS, and we will be posting it on the QIN-QIO website. You will receive an email from us with a link to it as soon as it's completed, and we've received the recording from CMS. This recording will be available to you at no charge, as all of this program is, and we hope that you will access it. One last item, I do want to also extend an invitation to you. If you've enjoyed today and you think that you will be coming back next month, please invite those members of your governing authority, your professional advisory committee, your consumer representatives who may be a Medicare-eligible beneficiary. Part of our goal is to extend this education to the community at large, and so we strongly encourage you to have a member of your governing authority or your professional advisory committee, especially your consumer representative, join this monthly webinar every month. And if you would just let us know when you log on that they're there, we would appreciate it. Thank you.
And one more ask for any questions. It's, again, *6 on the phone to unmute. All right, so I guess if we don't have any questions, thank you all for joining us today. As Kathy mentioned, within the next few business days, we will send out an email to everyone that attended that contains both the presentation and a recording of the webinar. So thank you all for attending, and have a great day.